Okay, so
and begin. What do we do? I don't know. How do we start these anymore? I don't know.
No, this is how we start them.
We just go.
Not the intro.
No, yes, this is the intro.
That's kind of what we've been doing.
We're winging it. Episode 29. Brought to you
30 though. It's 30.
Oh, it is 30. Okay. Brought to you by Alpha Counseling. Alpha is the largest, most respected provider for justice-involved clients in need of sexual offense-specific treatment services. Alpha clinicians are trained in cognitive behavioral interventions for sexual offense, which is, by the way, an evidence-based practice from the lovely University of Cincinnati Corrections Institute, which I'll be going to next month.
It is lovely.
It is.
Again?
I got to go back there for CBI SA this time. I feel sorry for the sap that has to train me, though. They're going to have 4 days of pure, unadulterated hell. But when you choose Alpha, you'll have the satisfaction knowing that our clinical professionals have over 60 years of combined experience in providing clinical treatment in both inpatient and outpatient settings. Probably way more than that now.
What if they're inpatient?
They
just really want to get started right now. They're so
impatient. They're inpatient treatment providers. That's funny. Alpha Counts. This podcast, this episode of the podcast is also brought to you by Prime Polygraph Services for all of your polygraph needs.
All of them.
And you'll find those.
How many needs
let's make
would
sure
there
we know
be?
what those are.
Yeah.
I guess, like if you're lying, right?
Yeah, it's never.
Then you need it,
and you need it,
Yeah.
or no. Like if you need to verify the truth, how's that?
That's
I like that.
Yeah, it's not a lie detector. It's
Yeah.
a verification that you're telling the truth.
There it
That
is.
sounds better.
Yeah. Prime
negative.
Polygraph Services has yet to develop a website, so there's that. But you can reach.
Too busy working.
Yeah,
man.
but you can reach them at 801-810-0490.
Is he in the yellow pages?
Again, for all of your polygraph needs. Or I guess you could Gmail them at primepolygraph@gmail.com.
At AOL.org.
At AOL.gov.
I do have a normal email for my real email address.
Musclecritter.gov.
Oh, God.
All right, let's get this thing started.
All right, now we're on.
All right, Mr. Edward Cook.
Welcome back, man.
Howdy.
Dude,
Good to be here again.
so how long is it? Make sure everybody knows how long it is when you're going to be off the market, so all the ladies know to like swarm you.
T-minus what?
Wait, just swarm me before or after?
Both. Yeah. Some of those chicks like the married ones, man.
Yeah.
I'll tell you what.
Do you know from experience?
No, I'm just saying. I'm just saying.
Me and Jeff are just
June.
dead quiet. Well,
Yeah.
June.
You're on your own.
Yeah, you two carry on.
Getting married in June.
June. We won't say where
Finally.
because we don't want to make a public invite.
Secret.
It's in the
Yeah.
group room.
It's
It's in the.
It's in the group room at Alpha.
be there.
Yeah. Yeah, they're getting married right next to the stain in the corner.
I felt left out. Everybody else is married.
Yeah.
Well, come aboard.
Was that what's called the dark side now?
The dark side.
Yeah, the dark side
Yeah.
of life.
Yeah.
Yeah.
It's just what happens.
Yeah, that's cool. Yeah, you excited about that?
Yeah, well, planning, it hasn't been easy. You know, it's not really. How was your planning for everything that you
I don't
went
know.
through?
I paid some loser to plan for
Oh,
me.
seriously?
Yeah.
Why didn't someone tell me that like 6 months ago?
I probably did tell you
Or
to do
having
that.
the money to do that, I guess, would be fancy too. I guess Alpha could have just sponsored my wedding.
Yeah.
Yeah, that would have really paid off.
Sponsor it.
Oh yeah, that would have been. Why didn't Prime Polygraph sponsor it?
That's a good idea.
Yeah.
Maybe make it still happen. But it's exciting, man. Going through everything, getting married.
Mm-hmm.
I don't know. You can start having kids. I guess you could start doing that anytime.
Yeah,
But-
yeah, you probably have.
Plenty of people get
Yeah.
started early.
None that know where I'm at.
Yeah,
No,
and if they were,
no confirmations.
you could be like, "Am I your father?" Polygraph question.
Maury Povich.
Nope.
You are not the father.
Nope. Officially, don't anyone else read this but me.
Dude, do you think you will interrogate your kids? Polygraph?
Oh yeah. And
Yeah.
if they're threatening the people they date when they grow up, things like that, absolutely.
Dude,
Oh my God.
It was a meet
How
the
good do you think
fuckers,
those?
right?
Yeah,
Yeah.
meet the fucker-
How good do you think those
parents.
polygraphs were on the Maury Povich show, where they're doing the paternity tests.
I don't even think they existed.
They probably didn't even really
They
do
just,
them.
they
They
just
just
put
went
a
back
letter
there.
out and said, what would be more interesting?
those
rolled some- they
paternity
had a magic
tests.
8 ball.
Those paternity tests were my favorite, though.
Well, I thought, did they do lie detector or just the DNA?
Yeah,
No,
they
they
did
were
lie
doing lie
detector.
detector.
Yeah.
Did they?
DNA would make more sense.
On
but,
Maury?
I think Maury had, and the lie detector says this and that. The one that would probably be good would be, I think, Dr. Phil would probably actually have decent
Dr. Phil.
polygraph exams on there, like an actual professional. Versus, I don't know about Maury.
Probably
Yeah.
not.
It might just be what's going to be more dramatic.
My-
Oh, yeah.
Dude, my
for
favorite
sure.
is on those like, because they have like a lead up. They have like a week of DNA paternity tests. And there's one sorry sap up there with like 10 dudes. And you go through all of them, and all those dudes are so stoked. They're doing like backflips when they find out. And they've never done a backflip. Yes. And then like but it comes down to the last dude, and you can just see the dread in that dude's face. And he's like, and he's like fearing it. And the
getting
girl,
narrowed down.
now she's she's like lighting up. Oh, I told him it was him. I don't know why they talk like that. But anyway,
But it is every time.
Yeah. She's like, I done told him it was him.
That's how
I
they get on
knew,
the
I
show.
knew it. I knew it was him. I told him. And then he says, "You are not the father." Yeah.
She gets
Pulls out a gun and blows his brains out. and then she like knows.
I missed
right
that
then-
episode.
Yeah. Then the dread goes on. Then
It was basically
it's a-
every episode.
Yeah, it's a good one. And then the dread goes on.
He shot himself on stage.
No, I'm just saying he's so excited you could imagine that happening.
Yeah.
And then like I told you. yeah. He punches her. But then you see the dread go into her face, and then she's all, "Oh, now I know who it is. It was the janitor."
Yeah, oh, the janitor.
Him again.
Yeah, those are always fun. I just love seeing people's hearts break. I see it in
If
their
you're going to go
face.
on that kind of show, though,
Yeah.
you're asking for
You
it.
do deserve it.
Yeah.
You do deserve it. That's for sure. So
Would you ever take a gig like that?
No, I wouldn't.
Really?
I don't want to deal with the drama.
No. Well, everybody's
Man.
got a price.
Would
though.
you guys? Well,
Like,
yeah, if
maybe-
he said
maybe
$1
for the-
million
Oh, yeah.
a polygraph,
well, just to run a polygraph.
just a polygraph.
Well, yeah.
Fine, $2 million.
No,
like
Barter up.
the worst negotiator ever.
I'll take it. No,
Dude, for
how
that
about
kind of
some
money,
more?
you should.
3?
You would have to for sure do
Yeah.
it.
Yeah.
Yeah. 3?
Yeah,
No.
for sure. Well, no, because that's that. Yeah, I wonder. Like that would be intimidating if your dad was a polygrapher.
Oh my god, dude.
I didn't even
And
think
then,
of
like,
that.
if you, I mean, just imagine. So it's
outta here.
right? So you have a daughter who's 16, and then homeboy comes over to take her out on a date, and then you're like cool with it. You're like, all right, here you go, and you do the fatherly thing, give the dude $50, $100, say, show my daughter a good time, and then he comes back, right? That happened one time when I took a girl out on a date. It was like to a dance, and he gave me. I think he gave
you
me
money?
Yeah, he gave me like $60. Like
nice.
sucker, I just spend that on his daughter. Come on, son. Yeah, I was like, no, I bought her really something nice, and probably bought her a Sprite or something.
McDonald's.
Yeah, something like that.
It's pretty nice.
But anyway, like she gets back, and then like a week later, he walks in, and it's like a meet the parents type situation. Like, come on in here, son.
Oh, God.
Dude, can you imagine that? And then he tries to run out, and then I close the door behind him. It's like, where are you going?
Wait, this random other guy, just my friend standing behind the
Yeah.
door. So you're hiding behind the door.
Yeah.
The 16-year-old goes to walk out. This giant guy shuts the door and stares at
It's
him.
like a mixture of
we sit him
it's like a
down.
mixture of Bad Boys 2 when Martin Lawrence and Will Smith confront that poor little sucker.
Oh yeah, that's
Yeah,
right.
that is so awesome. And then Meet the Parents, where you hook them up to a polygraph. That'd be so great. And then you find out that he didn't do anything with your daughter.
That's like the one benefit of polygraph, right? Like other
Yeah.
jobs, you can like be a mechanic, you can take care of all your own work, you don't have to depend on anybody else. I guess I can threaten my daughter's boyfriends.
yeah.
Yeah, that's what you got. Yeah.
yeah.
Not quite as useful in my day to day.
Yeah, that's what I would do.
Yeah,
What are
you-
you doing, Justin?
Putting it in my mouth.
Is this like he's like Jamie from the Joe Rogan show?
Pull that up.
Yeah. Make sure that's just like a fist between. So, well, so you're like our only guest who's ever returned, huh?
Yeah, sounds that way.
true?
What does
Yeah,
that
that's
say?
true. We haven't ever had anybody back because they all suck.
Why not? Oh, okay.
Kidding, everybody. We appreciate
Well,
anybody.
they're
who's
never
ever
coming back.
Yeah, no one's listening to this.
Yeah, they are. I remember we're the number one polygraph in all of Ogden.
In all of this
I'm the
building.
one
No,
polygraph.
polygraph or podcast?
Podcast. That too.
We're the number one polygraph podcast in
We're the
Ogden.
number one
Number one
podcast.
podcast talking to a polygrapher right now.
Yeah,
We're the number
yeah.
in all of Ogden.
Yeah, right now.
We're the number one podcast in all of Ogden.
In this room.
West of Harrison
That
Boulevard.
doesn't sound impressive, but there's actually 200,000 of them in Ogden.
Really?
200,000 what?
No, there's
Pod-
probably like -4.
podcasts?
I was just joking.
Oh, you just
Damn,
made
dude.
that up.
There's 80,000 people in Ogden, but there's 200,000 polygraph podcasts.
Just everyone has 8.
So it sounds right.
That's so funny.
Numbers seem to line up.
Well, so part of the reason I guess we brought Ed back on this was last time we kind of went over like a general idea of what the polygraph is, and I think we tackled a lot of. I mean, I know we went on to antipolygraph.org and talked about some of the nonsense associated with that. We had kind of a specific update with regards to the polygraph that we were involved in. I'm not sure how much other people were aware of this. This was kind of a big case. So I don't know if we want to start there and kind of go through some of this stuff and then kind of get into basically the use of the polygraph as far as it applies to the treatment that we do, and then other uses of the polygraph that go beyond just like any types of sex offender treatment or anything like that. That's primarily what we use it for in forensic treatment. And going from there, it seemed like a good place.
Yeah, are you talking about our interaction with that federal judge?
Yeah. So there's this is I'll kind of there's a story that was so this is out of the Denver Post, and the just to give appropriate credit here. So this was the headline was Colorado sex offenders lie detector court win could have a big impact. So this was the 10th U.S. Circuit Court of Appeals finding Tuesday, but this was all the way back in, I think, 2016, May of 2016. So this was 2 years ago, and that's about that summer when we went in to speak with the federal judge. So we'll talk about that here in a minute. So the 10th Circuit Court of Appeals overruled a lower court's decision and agrees with Brian von Baron, I hope I'm saying that right, that the lie detector examination would violate his Fifth Amendment right against self-incrimination because polygraphs are used post-conviction on sex crime offenders across the nation, especially in Colorado. The appellate ruling could impact the practice's implementation in Colorado and beyond, observers say. So basically what was going on here was in 2005, this Von Baron guy, he was sentenced in Colorado's federal court to 121 months in prison and 3 years of supervised release for receiving and distributing child pornography. But as part of his conditions for release, he was ordered to take a sexual history polygraph, requiring him to answer 4 questions about whether he had committed illicit sex acts for which he was never charged. So before we kind of get into that, Ed, can you kind of elaborate on what a sexual history polygraph is, and maybe we can kind of talk about why we do those a little bit?
Right. So sexual history polygraph. So towards or earlier in treatment, guys are going to go through their sexual history polygraph, and part of that is to help make sure that they're going over their sexual history accurately with their therapist. So basically, their therapist they want to make aware of what kind of history they have of victimizing others, whether one main focus often is other hands-on victims. So I think there was a issue over at Bonneville. Was it a few years ago that something came up and they were concerned about Fifth Amendment for this as well?
So Bonneville being a halfway house here.
Yeah, the Bonneville Community Correctional Center is actually a long time ago.
Oh, really?
And very similar issue, yes. And
Right.
that made its way all the way to the Utah Supreme Court.
So part of what you're talking about, so there are concerns with Fifth Amendment, right? If I'm going to go into a sexual history polygraph, if I know that if I'm actually honest with my therapist or the polygraph examiner about my history, like let's say I had 10 other hands-on victims that I've never been charged for. I know if I went into a polygraph like that, if I know that if I'm actually honest, I'm going to have other charges pressed against me. No way I'm going to be honest. And how does that benefit anybody, right? Like, how does that benefit therapy for preventing these. So I try to make clear, and I think most do now, while you're going through there, that if we don't need identifying information for previous victims, hands-on victims, just mainly looking for what their history was, whether it was victimizing minors, whether it was internet crimes, whether it might have been one issue as an adult where they had an internet crime like you might see on Crime Watch or To Catch a Predator or something like that. So therapy would obviously look different, I imagine. I mean, you guys would be the experts, but for someone that had one internet crime as an adult versus someone that's had an entire lifetime of victimizing others, maybe minors of certain ages. So part of what we go through on, and there's two different kinds of sexual history polygraph exams, but the main one that's used more often is looking at their other hands-on victims. Have you forced sexual contact on anyone you haven't disclosed already? Have you had sexual contact with any minors since you've been an adult, again, that you have not already disclosed? Some other issues like that. But again, the main issue is just making sure your therapist is aware of what your actual history is so they know how to direct therapy, is my understanding. Would that be correct for you guys as well, what you really want to see for something like that on your side?
Yeah. Mm-hmm. Yeah, that's accurate. That's actually helpful for any clients that happen to be listening to this. If I try to send, so my clients that go to you, before I send them to you, I want to make sure that they feel comfortable that they've truly let me know everything in their sexual history. And I'll even just kind of encourage them, say like, hey, look, it's not just the obvious stuff, but man, like even anything that's like slightly embarrassing, just sort of hanging in the back of your head somewhere, something weird that you did when you were 12. I don't know. Just tell me, get it off your chest, and you're going to feel a lot better when you're sitting in front of Ed. So I kind of send that sales pitch to him.
And I think that's a great example. And I think Alpha, I think you guys do a great job of kind of getting you guys ready to know what to expect. And I think that's important. I think two things that I often see, or I might see more often. So if someone does fail a sexual history polygraph, I think two of the main reasons that I might see when they come back for the second one was one, they may have been, in their eyes, screwed over by the system, right? Maybe they had police officers lie to them to catch them in something or whatever might be going on. So they just think, hey, Alpha's out to get me. They just want to get new charges. They want to throw me back in jail. So they feel like, yeah, if I'm open about these things, they're going to press new charges. I'm going back to jail. No way I'm going to be open yet. I think the second reason I see that someone might fail a sexual history test more often would be if there's, like you said, there's things they're not really comfortable about talking about yet. Maybe there's some really embarrassing things that may have happened in their past, and they have been with their therapist for maybe 3 months, 2-3 months at this time, and I'm a complete stranger they're coming into, so they might not be comfortable yet. So I've had guys come back for that second polygraph, and it ends up being one of those two things more often, I think, than not. Huh. And like you mentioned, prepping guys, if there's things uncomfortable, I can think of one situation, I bring this up to guys in my exams too, where I had a guy, he ended up failing his initial sexual history polygraph, and like I said, Alpha's great. You guys work with these guys, try to communicate what was bothering you. You're not trying to threaten these guys to come in here, which I think is the right atmosphere to come in for a polygraph test. So this guy failed the test, comes back the second time, and we're talking about what might have been bothering him, and there was a question asking if he'd forced sexual contact on anyone. And that's where he more specifically was showing a significant reaction. But when I was talking to him, he said, during the test, when you asked me about have I forced sexual contact on someone, I started worrying because when I was a minor, a girl accused me of rape. He's like, I know I didn't do it, and sat and explained the whole situation, but he hadn't talked to me about that during that first exam, during our interview. So he said when I asked him the question on the test, he's sitting there worrying. He's like, well, this girl accused me of this when I was a minor. I know I didn't do it. It shouldn't be a big deal. And he's answering no, right? Yeah. So there's something he's sitting there worrying about that he hasn't talked about that's causing a reaction, right? It's not technically a lie detector. It's showing that reaction, right? And so I always try to clarify that if there's something that's not clear that you're worried about, let me know so we don't have that same issue. And the second time we ran it, I asked, other than what you've talked about, have you ever forced sexual contact on someone? He passed just fine. So that's one of the few situations I can think of when our guy came that first time. He wasn't, I don't think he was really trying to lie, but there was definitely something related to the question bothering him that he hadn't talked to me about.
So does that, I mean, and maybe you can clarify that a little bit, and then we can kind of come back to how this plays into this Supreme, or not the, or this district circuit court decision, I should say. Because, so is it, like you're saying, it's not a lie detector, right? And I think that's a misrepresentation of what that is. And I mean, I have to be a true believer going into that. One of the things that I train therapists on a routine basis is if you think your client is going to fail the polygraph, do not send them into it. What's the point? I mean, if you believe that your client is lying, then just tell them you think that they're lying. Just tell them you think they're being dishonest and cite the reasons why. Now, I've done that, and I've been wrong at times, and I'll give them the reasons why. Hey, I think you're being dishonest because what you're saying doesn't match up with the behaviors that have been reported to me by your PO or by other people or that I'm seeing from group therapists or whatever it is. So that's where I might say that. But I think using it as a way to catch somebody in a lie is a foolish way to use a polygraph. I think if we're using this as a method of, I'm using, especially the sexual history is even trickier because we're using that for treatment planning purposes. But when you're saying like that they're worried about it, what exactly is the polygraph? I mean, and I know you don't want to talk too much about like specifics because then, you don't want, I mean, I think it'd be incredibly difficult to train yourself to beat this or something like that. But when you're asking what is it that they're worried about, what is the polygraph detecting at that point?
Right, so we're looking at what physiological data. So you're looking at your change in blood pressure, right? So if I'm asking someone a question, is there a raise in their blood pressure and pulse? Sweat. If I ask someone a question, do they have a change in their sweat? More sweat coming out of their fingers when I'm asking a question. We also have plethysmograph, not to be confused with a separate plethysmograph test that gets used for these guys sometimes.
Yeah, the one that's on me right now.
And that's going to measure suppression of your blood volume and pulse amplitude in your finger while we're testing. So there's multiple things going on. That's a polygraph, right? Multiple graphs that we're using to measure these things. And there's going to be multiple presentations on most test formats. So you're not just saying, well, he happened to have one reaction when I asked him this question once. It's going consistently multiple times through multiple presentations. So there's something bothering this person relating to this, which is generally they're lying about something. Or on cases like I mentioned, there's something related to the question that's bothering them that they're not telling me about. And I can't read someone's mind, so I don't know what's bothering them. But after a test, I'll always ask, is anything bothering you? If we can clear something up, if I can spend an extra 20 minutes with someone, if afterwards there's something that we hadn't gone over, obviously best case, we've talked about it ahead of time. But if after a test there's something else that happened to come up, and that can happen, I'm sure I can imagine that happening to me, then if I can spend extra time to clarify, reword something, and spend a little more time to run something, I'm happy to spend more time with someone in that case so they don't have to reschedule to clarify something that might be, not as serious or that they hadn't talked about that, just they knew about right then, even we could take care of.
So if you ask that during an examination, like, hey, is there anything else that's bothering you? Is that a pretty good indication that they probably need to really... No.
I mean, if I ask it, like, there's something going on. Is something... Yeah. So not in this... No. So I'll ask it to everybody. I want to clarify, hey, were all the questions that we asked you really clear? Was there anything bothering you during the test? Like I say, I've been doing it for a little while, but I can think of one situation like that even. So there's been one situation that came up where a guy, so his charge, I think the wording in his conviction, the charge talked about forced sexual contact or something. What actually happened wasn't, our definition necessarily of forced, right? Forcing sexual contact on someone physically. They're telling you no, or, they're trying to push you off or stop you, or using threats, right? So his actual crime wasn't related to that, but the charge was. So we ran through a test, and after the test, he brought up, hey, during the test when that came up, I was really worried about this because the charge said that. He's like, that's not what actually happened, but I felt like I was really freaking out, right? And I haven't scored everything at this time. So same thing with that last guy, right? So he talked to me about it. I'm like, okay, if that was bothering you, then let's talk about it. Let's clarify. Let's reword this and run it again. And that was the one situation I can think of where we ran the first one. When I scored them both later, the first one I think was going to show a significant reaction, whereas the second one didn't. So again, I can't read someone's mind. If something's bothering you, let's clarify it and talk about it. I'll spend extra time with you if I can but again, related, right? Forced sexual contact. Well, they said I forced it. Let's talk about that. So there's nothing related to this that's going on.
So yeah, you're not reading minds. You're just reading the way the physiological responses show up.
Right.
So can you talk about the different things they're hooked up to? Gauges, switches, levers, and buttons, and
yeah. So there's the electrodes,
lever.
electrocutions.
Switch it.
The
Okay,
knives.
now you have to tell the truth.
Like
The
one of those old
alarms,
slot
The switch is
machine.
on.
Yeah.
So there's 2 pneumotubes around their upper and lower chest that are monitoring upper body movements, and this is the same type of thing I tell them when they're in there. And then they're sitting on motion sensors. It's going to monitor lower body movements, and those are all just basically to make sure that someone's not moving around during the test, right? So we have a good, clear reading. Then there's the blood pressure cuff that's going to be on their arm to measure change in blood pressure and pulse throughout the test. Then there is the EDA plates, or galvanic skin response, if you want to, how they used to call it by that instead of electrodermal activity.
Oh, is that old school?
Yeah, I think more often it's called EDA now versus GSR, but
Electric dermal.
electrodermal activity.
Okay.
But that's going to be on a couple of fingers, a couple little sensors that are going to monitor your sweat response, perspiration, and then a PLE plethysmograph is going to be on one of your fingers. So it's basically like in the hospital when you put the little oxygen sensor on your finger and they're measuring. So it's basically that type of device. It's going to be on a finger. It's going to measure suppression, so blood volume and pulse amplitude in your finger while we're testing. So basically the way they're looking at the research and things now is to tell a lie is going to take more cognitive function, right? It's going to take more work to tell a lie than the truth. So when it gets scored out by me and the computer scoring system afterwards, it's just basically looking at how your body's reacting when you're answering these questions for everything as far as that goes.
But any one reaction on those isn't necessarily going to indicate deception.
Perfect, yeah.
Because so this is something that I was listening to a podcast about this, and they were talking. It was about a murder trial, and they talked about the polygraph, and they mentioned briefly that the reason why they're not admissible in court, and I know this is incorrect, so we'll revisit this later, but the reason why they're not admissible in court is because they actually don't detect deception. They just can detect anxiety or the absence of anxiety, which I was like, nah, that's not accurate. And this podcast was not specific to or about polygraphs in any general sense, but I think people get that idea. And so is it wrong to say that a lie, those physiological responses, have a pattern to them that's consistent with deception versus like, I just take a deep breath during this question because I yawned and I'm screwed. Like,
right.
Obviously you would see a variation.
Right. And like you say, if you yawn or if there's a movement or if someone coughs, if I ask someone, did you shoot John? And if someone coughs right then, they take, maybe they yawn or maybe they move around or something like that and there's some reaction going on. There's those artifacts. So if there's artifacts that could have any type of impact on those reactions, I just can't score that, right? So, and that goes back to my motion sensors, right? Part of the reason those are there is to make sure someone's sitting still so that doesn't happen, good or bad, right? If someone is getting asked a serious question, did you shoot this person, and they're moving around, there's a reaction. I don't want that movement and a reaction caused that might be from that movement to score negatively against someone.
That would disqualify.
Like that. So I just can't score that portion, right? So in some situations you can ask more questions, so you have more data to score, or maybe you have a little less to score when you look at it after if it's not clear right away. So you have a higher chance of getting an inconclusive or no opinion, because I'm not going to score out something and say it's a pass or fail if it doesn't clearly score out that way. So obviously no one wants to get that no opinion or inconclusive, but if that's where it is, that's what I have to give. And there's statistically those are just going to happen sometimes.
But those artifacts, you do some due diligence prior to asking that question, that important question for why they've submitted themselves to the polygraph in the first place, to have an idea of how this particular person responds to or demonstrates physiological artifacts when they are deceptive, when they are lying. You have an idea of that prior to asking that question.
Right. I mean, in general, I'm looking at those reactions, right?
And are all the reactions different?
So,
the way that I lie, is it going to look different the way compared to Jeff lies?
So I think the main thing, and there's going to be there'll be some physiological, yeah. Some people have more significant, like for me, for example, I'm a terrible liar. So like back in school, if I was on these things, doing something as simple as just kind of, practicing things like just write a number down, put it sit on it, and let's see if we can guess who, what number you wrote or what state you were born in. And looking at mine, even if I know what's going on and I'm trying to hide it if I can. I mean, mine's just ridiculous. Mine's horrible. It's just a huge reaction when I'm lying on those things, whether I know what's going on or not. Some people, overall, the reactions might not be as severe. Like, it might not be as high as mine, but
do.
So I guess it's different from person to person in that way. Some things are much more obvious than others, but it's still the same type of thing, though, right?
Do some people react more to like one particular sensor? Like, you know, if Mace and I are comparing the differences in how we lie, and, you know, what would potentially Mace's AD, whatever it is, spike higher than if like, maybe mine would react more with me fidgeting and moving around a lot.
Yeah, it might do things like that. I mean, obviously you don't want to fidget, but yeah, some people, for instance, if someone has like a big yawn in the middle of a test, for some people, cardio, everything might raise with something like that, possibly. Mm-hmm. Whereas other people, you see the exact same thing. They'd have a huge yawn or something before or during a test, and you don't see really any change in them on those type of things. So some people you see a little bit more than others are more reactive. Some people their cardio might be, you know, moving around and much more severe than others as well. So yeah, there's definitely some differences between everybody on that, whether it's a little more obvious on some than others.
What if they're like super out of shape and just have like really bad cardio in general, you know?
Then they're lying.
Yeah.
You're all, what's wrong with you?
We need to go to the hospital.
So okay, so hopefully that's kind of a short crash course in this, but I guess the message behind that is, and I think getting into the specific artifacts might not be a great idea of talking about those, but I would just say there's more than just like, oh, this guy's anxious. It would be weird if you're going into a polygraph and you weren't anxious. I would have to imagine those things going in
You
there.
took a polygraph before, didn't you?
Yeah, I was super anxious.
Right, and did you pass?
Yeah, absolutely.
I think that's probably one of the most common questions I get is, being anxious going to affect my polygraph? And I think it'd be more uncommon to ever see someone that came in that wasn't at least a little bit anxious or nervous. Everyone coming in, and I think they all worry about it, so they must not think everyone is, but everyone coming in is nervous, anxious. Mm-hmm. They're really worried what's going to happen, don't know, and we don't just rush into it. So
and that's where, as I was listening to this podcast, the gal who was hosting this podcast had made that point. She had said everybody's anxious going into that. I'm like, well, yeah. But to me, what I've discovered along the way is that I think that really the quality of the question matters more than anything. So that the question that's being asked, the quality of the question that's being asked, what's it's being asked about, those are the things that matter more than anything. Because I think, you know, if I'm being asked one question, real simple. Mm-hmm. If I'm being asked 80 questions, okay, that's different. I mean, there's so many things and so many variations. And two, I think noticing what they're asking questions about. I mean, whether or not I did this particular thing versus that particular thing, and you're asking me only about 100%. That, that's really, that seems percentile-wise, that's going to be really accurate.
And that's exactly something they point out, especially back in school, going through. So a perfect example of that is if we're going into crimes, right? Mm-hmm. Let's say there's $1,000 missing from a business, and they want to run some polygraphs to find out who stole that money, right? So they think $1,000 missing. You ask the person, did you take that $1,000? And let's say I know, well, I only took like $750. This other guy took $250. So if I'm asking a really clear question, did you take that $1,000 from that business? I know I didn't take that $1,000. So for some people, it might be like, nope, I didn't, and I'm not lying, right? Mm-hmm. I didn't take that $1,000. So you get taught that that's not a good question. A better question is, did you take any of that money? You know, and now you don't have that exact amount. It's more clear on just what you're asking. It's including that. So you have to be careful and like you said, being really clear on your questions. Mm-hmm. So there's different test formats. You know, I'll start off by saying, so some have different types of questions and might not be as specific as other formats, but one of the ones I use more often, I want my main issue questions to be as very specific and behavioral based as possible for the particular format that I use. And again, so it might be different from examiner to examiner depending on the format. Not to say one's better than the other necessarily, but mine's the best. No, I'm kidding. But,
humbly stated.
But
no, you're not.
So for instance, for this one, I'm not going to ask questions on the majority of if I'm using this format, which I use other ones as well. But for this format, I'm not going to ask really broad general questions. So I have a lot of POs or therapists sometimes come and say, I want to know if they have broken any other laws or during their probation. It's like, okay, did you break any new law during your probation? So what could that include?
Speeding.
Is spitting on the sidewalk? Is it spitting? Is it something more serious? Is it,
Murder.
using drug? Is it murder? So to ask a question like that, did you break any laws during probation? Of course they broke something, right? You can't, that's just so broad.
Everybody, yeah.
Particularly like if they're under like probation or parole,
Right.
And if you're defining a breaking of a law as a violation of your probation or parole.
So that can be tough. So again, that's to this specific type of polygraph. There's some other ones that might have some general questions, but for this format that I use more often, I want something specific. So for a post-conviction sex offender test, if I'm doing, let's say, a maintenance exam for probation, instead of saying, have you committed a new crime, do you have a new victim? I want to be more specific. If a therapist or PO wants new victims, okay, what was his crime of conviction? Did he force sexual contact? Was it sexual contact with a minor? So we might ask something like, during probation, if you had unauthorized contact with minors, because that's, I think, a good place to start to be concerned with some of that kind of stuff. Or if they really need to know if it's, they have concerns, did you force sexual contact on someone during probation? So being more specific is much more clear for the person taking the test, and I feel for the majority of these tests it's going to be better.
So the question formulation would be more like it describes the examinee's behavior. It's also, I think,
not feelings, right?
Right. Time delimited. In other words, there's a date and a time frame, and simple yes, no, direct, and easily understood. So you don't presuppose guilt or deception in the questions. You avoid legal terms or treatment jargon that they may not understand.
Right. Make sure they understand. So it's to the client, right? Some clients might understand some of that really well. So you might use some of their terminology. If they understand something that's more clear that way, yeah. But if they don't understand some of those things, then make the verbiage correct or more relevant to that person.
Okay. So, I guess I just want listeners to understand the legitimacy of this is to not discount the use of this, because this is an important part of what we do specifically with regards to the sexual history polygraph. And to the Von Baron case in the United States, Von Baron it's the Von Baron VON space capital BEHREN is the name of it if anybody wants to look it up. And this was the 10th Circuit Court, and so basically, so again, he was sentenced to like 10 years in prison, 3 years of supervised release. Now near his release in 2014, his conditions were changed to include successful completion of an approved sex offender treatment program that was in Colorado. And so this was by the Colorado Sex Offender Management Board, that they require programs, including the one that he was attending, which was called Redirecting Sexual Aggression, RSA, to subject the clients to a sexual history polygraph. So the RSA required the clients to sign a contract allowing the program to report any illegal activity to the authorities. Now, this is where things became kind of tricky, because his refusal to comply with all of RSA's conditions would result in dismissal from the treatment program and likely revoke his supervised release condition. So the Court of Appeals said, well, hold on, that's not necessarily fair. So they said that he was scheduled to do this, but they said at least 3 of the questions that were on this, the Court of Appeals looked at this, said at least 3 of the questions would require him to admit having committed a felony. So if he answered yes, then the examiner could ask how many times, and through a yes answer could not sustain a conviction on its own. It could help narrow the investigation or whatever. And they found that this level of self-incrimination was constitutionally impermissible. So so even though we're allowed to ask incriminating questions during this, we can't do it in a way that's going to, because it's part of the rehabilitative process, and I'll talk about that here in a minute. The government cannot compel somebody to answer those questions because it would be a violation of their Fifth Amendment right. So what they found was they called this a Hobson's choice, because it's just a legal term, where he was required to sign an agreement that authorized his treatment provider to disclose his answers to authorities. He was left to decide between 2 impossible choices. If he refused to answer, he'd be kicked out of the program and in violation of a supervised release, which could send him back to prison. But if he took the polygraph, his answers could be used against him. And so they determined that the polygraph exam could not be mandated as a result of that. So we got commissioned, I guess asked by the United States Probation Office based on our polygraph, because they had read it before, like our preparation material for the sexual history polygraph, to go in and talk with, it's a Judge David Nuffer, or Nuffer, Nuffer, and we went into his chambers and described to him the way that we use it. And Jeff, I don't know if you want to kind of talk a little bit about what our mentality was when we kind of formulated that in terms of putting that together, and what the idea was when we were putting the sexual history polygraph preparation piece together for them.
Sure, yeah. So I guess to back up a little bit, when a client of ours goes in to take a polygraph, or I guess when they're at that stage in treatment, we've crafted a packet that we give to them beforehand. And, in this packet, we actually have some wording in there about we don't violate their Fifth Amendment right, all those types of things, and some pretty clear-cut instructions through consultation with Ed and another polygrapher named Tana Stone that gave us some ideas about what would increase the chances of our clients passing the polygraph, provided they tell the truth. What can we do to eliminate any of the ambiguity or any of the gray area that leads to failures? And so this packet has information on how to pass, as far as like getting plenty of rest, giving yourself time to get there, not taking any weird medications that you don't normally take, those types of things. And then also a series of questions that basically by the time they're done filling out the questionnaire, they've pretty well detailed their entire sexual history. And so every sexual contact they've ever had, and then a little more attention to detail specific to, whoever they happen to victimize, as far as a little more specific with what they did with that person or people. And a big key component to it is at no time do we ask them any identifying information. They don't have to say their name. And in fact, and this is what happened with the judge, that they were worried that even the judge was, I guess, initially worried that even though we don't ask them to say names of people they've had sexual contact with, that other information like age of victim or things like that could come out that would then zero in on the person without saying their name. But the way that we have our packet worded and created is that they're giving much more, I guess, vague demographics type descriptors of their victims. And so I don't have the sexual history packet in front of me, but essentially we allow them
I
to.
do.
Okay, awesome. Do you want to detail the different categories?
Well, yeah, and so this is a big reason why is as therapists, the position that we're in, and clients need to know this too. So part of the therapeutic relationship relies on confidentiality. And what you're going to be talking to me about, I'm going to keep confidential. But there's limitations to that. So obviously, if a client's telling me that he's going to kill himself or hurt, imminently going to hurt somebody else or kill another person, and I believe him, and he's not willing to accept any intervention from me, then I need to notify somebody outside of that session. That allows me I have a duty to warn at that point. Technically, like if we were sitting in here and Ed was my client and he said, I'm going to go rob the Golden West Credit Union. Well, technically, I couldn't say anything to anybody about that because he's just saying, I don't know if he's going to rob it with a note. I don't know if he's going to, have a fake gun. He's not saying he's going to hurt anybody. There's nothing to disclose at that point, right? If he says, I'm going to go to Golden West and shoot Jim in the face. Okay, well, now I know,
that's hilarious. I know. Yeah.
Poor Jim. So then I'm gonna. So then I do have to, because now he's identified somebody, and then there's an imminent threat against somebody's life. So that's an obvious one. The other ones are when they're disclosing a crime for which there's abuse against maybe what we call a protected class. So this would be against a child, for example, if they've detailed any type of abuse, including sexual abuse, regardless of how long ago it was. If they tell that information to me and they give me enough identifying information, then I'm required by law to do this. Now, this gets tricky, though, because if a client tells me, hey, I murdered somebody 10 years ago, and buried their body in a lake and I'm not going to tell you about it. I mean, do I really have enough information at that point to report this to anybody? They haven't given me a name. They haven't given me, where this happened. They didn't even tell me when it was. They didn't tell me which lake it was. I don't have any information to tell anybody about anything. How can I break their confidentiality to that point? Right?
I'd be more curious of how they buried it in a lake. That'd be impressive.
Oh yeah, buried. Yeah,
that is a tricky one though, because I had maybe about a year ago a guy that was about done with therapy, so long since passed his sexual history polygraph, and wanted to also seek out treatment on a separate sort of deal, like at a private provider kind of deal. And so he was talking about some of his past stuff, and he told her like anything he would have put on a sexual history, and she kind of made a fuss about it, but she was like, oh, I gotta just so you know, I have to report that. He was talking about an offense against a minor. And so he came into our session kind of freaking out. He's like, I didn't tell her anything about it. I just said that it even happened. I didn't even say an age or anything. I was like, she's probably not overly used to working with that. It might have caught her off guard, so she's just kind of covering her butt. I was like, but that's not going to go anywhere. Don't worry. You know?
Well, yeah. So again, as a therapist, I mean, part of my job is I never want to violate your confidentiality. Like, that's my number one duty, is to maintain that. And so if I called up a police station and said, hey, Ed told me 10 years ago he murdered somebody, or not even then, if you just told me a while ago he buried a body in a lake with scuba gear, and,
which is impressive.
The police are gonna, I mean, I don't even know if I could use his name when I'm disclosing that. Like, my client said this, and so a lot of times I think clinicians get scared into this idea, like, I've got to report it to cover my butt, and that's not really true. So on this, if a client were to give us identifying information of a previous victim, and specifically a way to maybe get in contact with that person or something like that, if you give me at least a first and last name, then I'm going to be required to report that. So we don't even allow them to get close to that. We don't allow them to get close to any of those things, and we also don't detail, because it can get, I mean, so if I have on previous polygraphs, I've seen, like, what relative is this? Well, sister. Well, if I only have one sister,
right.
Okay, now we know who it is. So how we specify this is when the client's completing this, first of all, we, on the name or identifier, what we tell them is, don't use a name. Don't use an actual name. We've already pre-labeled them as A1, A2, A3, and this is for sexual contact with anybody younger than them. And we say you can leave it like that, or you can use initials, or you can use a fake name. Okay, we don't need this. Now, with the identified victim in their case, they can speak freely about it because that's already on the record. There's nothing necessarily to hide there, right? When we do ask, now the relationship is important, and it's important for a couple of reasons, specifically with regards to risk assessment, but we don't need to know the specific relationship. So what we do need to know is, are they related? In other words, is there a blood relation there? Are they unrelated, meaning that the client knew this person and they had a relationship, but they weren't blood related? Or were they a stranger, and that means that they had sexual contact with this person in less than 24 hours? We ask if the person was a male or a female. And when it comes to ages, like Judge Neufer was saying, you can't get too specific, because then you start to narrow this down. If I start to narrow it down, I knew it was then, and I say my age at the time and their age at the time, simple little bit of math, and if there's an accusation out there, okay, now I've got it, right? And I can incriminate the client. So their age at the time, we put age ranges, like stages of development. So we put infant, prepubescent, adolescent, and adult. And I give the client age ranges, but I don't actually tell them what the ages of those are. They get to kind of define that for themselves. For the client, my only concern is, were they a juvenile or were they an adult? Were they under the age of 18 or were they over the age of 18? And then even number of times, we don't even really have them specify that beyond if it happened one time, rarely, occasionally, or frequently. And all these are just check boxes. So the client technically doesn't write a name, and then they just check relationship, male, female, all those things, and there's nothing in that thread that would then incriminate them, but that gives enough information so then when they come into you that they're going to be able to pass their examination. So the purpose behind that then is we take that information and we can use it for treatment planning. But based on that, I mean, how does that then help you help the client have a higher success rate of passing that test.
Right. Well, one, I mean, filling out a sexual history paperwork ahead of time should always be required for these things, right? Like whether the examiner does it or you guys do it. Because if someone comes in, and I've had this before, and often you're supposed to send them away, right? If someone comes in, they haven't done any pre-work, send them away a lot of times. So, you talk to guys, you guys have people coming in there, in their 70s sometimes. If you ask someone on the spot, how many people have you had sexual contact with? Are they all going to know exactly how many? If you ask them as an adult, so since you've been 18, have you had sexual contact with any minors? Now, if someone hasn't had a little time to think about this, they might freak out like, well, I know I went to a lot of parties when I was 18 or 19 where some of the girls
start critiquing every situation.
Where some of those girls at those parties, they might have been 17. Did I make out with any of them? So on the spot, they might really freak out like, I might have done these things. What's going on? Whereas if they've worked with their therapist for a while, had time to think about these, a really important thing I think also is clarifying exactly what you guys mean. Like what is sexual contact or what would this count as that? They have a chance to get a lot of those concerns out of the way, clarify things, have some time to really think about these things. So by the time they get to me, they're much more confident and comfortable. They might not always be 100%. They might still have some worries like, I don't know, man. There might have been someone else that might have been 17 or 16 when I was younger that I might have had some sexual contact with.
There might have been 17 or 16 others.
So with a lot of these guys, I try to clarify because I think a lot of people overthink when they come in.
Well, yeah, and when I'm prepping my guys, so we go through that whole assignment, and then I usually tell them, here's the questions you're probably going to hear.
Or an idea.
So
of
they know.
The
So it's not,
they're
not getting broadside. I usually will pull up a previous polygraph that someone just did, and I'm like, here's the last questions the guy had before you.
Right.
This is probably what you're going to hear.
And you have an idea, right? Yeah. Obviously, it's not always the same. It's going to be case by case for some, but if someone's had time to think about that, there's less stress. And I try to stress with the guys that are overthinking. I think there's a big difference. If someone asks me a question and I know I'm not telling you something, I'm clearly lying. Versus if you ask me a question and I'm sitting there like, I can't think of any other thing like that right now. You're not, saying no, that's not lying. And maybe a month down the road, I'm like, oh man, when I was 18, I think I remember making out with this 16-year-old at this party. If you didn't think about that back then, you're not intentionally lying, and that's what you guys really care about, right? You guys care if these guys are actually trying to be as open as they can with you, so you know what this looks like to go forward, right? So I think that's where the importance of some of that comes in, having time to prep. Do you get guys that, you mentioned talking to the judge, do you get people outside of this that get angry that, why don't you want more information about their other victims? They need some way to feel better for these things. You should figure that out.
Well, so it's a misapplication of what, or I guess a misrepresentation of what we're attempting to do.
Purpose.
What I would say is those people, if they're working with sex offenders, then they probably ought to not be working with people who've committed a sexual offense, because so that's my client and.
What is it they're going for? People that make that complaint that we're not doing more digging, like what is their point of view?
Well, in the past, people have said that they want restitution for these victims. They want if maybe those victims need to be in therapy and all the rest of it. Now, look, I don't disagree with that. I don't think that that unsolved cases should, I don't think those people who have been sexually victimized by any of our clients deserve to live a life of trauma if that's the case. But here's the thing. This is the line of work that I chose, and these are my clients. Those are not my clients. It's not that I don't have care and consideration and compassion for them. A, I don't know who they are. And B, my objective is I'm trying to work with the guy sitting in front of me to help him rehabilitate the way he thinks about things and how he manages his own behavior, such that he doesn't do any more harm to anybody else in the future. And he's successful in his own life. And a byproduct of that is he's not creating new victims. So I can't mix my goals here. I can't say, well, I'm gonna start. That would be like a prosecutor or a defense attorney trying to discover all the things that their client has already done and then make sure that those other people get rid. No, you don't do that. You focus on the pending case that you're working on. So it's not again, I just don't have I can't focus on them because this is the what I've chosen to do. And so yes, they do get upset with that, but that's not the purpose of what we're doing, because the purpose is, and the example that I use is a client that I worked with, and he came in on a solicitation of a minor charge. And for those who don't know, that's like a to catch a predator thing. So he had contacted what he believed to be a 13-year-old girl and arranged, a sexual encounter with her at a park. He wasn't really ever talking to a 13-year-old girl. This was a sting operation. This was a person from the Internet Crimes Against Children. And then when he got to the park, he was arrested. So, I mean, if we take a look at that objectively, what happened? He actually never touched anybody. He actually never talked to a 13-year-old girl, and he was arrested before anything happened. So you could say in the scheme of things, very little harm was done by that guy. However, when he prepared for his sexual history polygraph, he had 17 undetected victims that were hands-on that he had disclosed. Now, the reason why that's important is because his treatment plan looked very different once I discovered those other victims. Because now I knew, okay, we're dealing with a completely different type of person here who needs another level or another layer of treatment to address some things that previously would not have been detected. And that's why it's for treatment planning purposes. And same the other direction. If the client's sexual behaviors are rather normative his entire life, and then there was one key area of his life, maybe a 6-month period, in which he went off the rails and committed his offense, that's an important topic of discussion in therapy, to understand what happened in those 6 months that took you off track, that led to your offense. How can we problem solve around that? How can we identify the lifestyle factors that then contributed to your high-risk situations and high-risk thinking and high-risk behaviors that added to your offense, and let's control for that. That's really important information that I need to do the work that I need to do, and that's why we're doing it. So that's
right.
Yeah,
the important part of the important part of the sexual history, where it goes, and the end goal is to not have new victims, right? Which I think some guys coming to me, I've even talked to a guy that told me that he heard, I think it was when he was in jail, which you don't always get the best information in jail or prison. He heard the recidivism rate for sex offenders was like in the 90s of the percentile. It's like, where'd you get that information? Well, my friend's wife. I'm like, well,
she knows.
Fine, I believe it. Well, yeah, I don't like kind of based what you were talking about either. Is just that idea of if someone's coming into treatment under the umbrella of let's address this stuff, you're not going to incriminate yourself, let's work on it, and then he tells me, and then I go back. I'm not a lawyer, but I'm like, I feel like that would get torn up in court. Like, he admitted to that in treatment, where you tell him it's not going to be held against him, and then now you're trying to investigate this and hold it against him. Like,
well, and it would,
because there's no way he would have told me that otherwise,
right? And it would get torn up in court, except because Alpha were such badasses that we wrote our sexual history polygraph such that Chief Justice Newfer said, "Yep, this is going to work." And now that our polygraph policy with regards to how we do this is now basically going to be put as a federal guideline for all sex offender providers to be doing this. I mean, I don't know when that goes into effect.
Is it going to be your actual paperwork that's going into there, or just like the basic understanding?
We gave it to his clerk. We gave it to his clerk and said, "Do what you will. This is non-proprietary." I mean, I think it is proprietary, actually. But I don't care. I mean, if we didn't say you couldn't use it.
Yeah, we didn't.
And his clerk clarified at least twice further with me, and they had said, "Yep, this is what we're going to do," because and honestly, that's how it should go. I mean, to be completely fair, if Von Baron's therapist and or probation officers were asking him to give identifying information, then to then report it, they're just doing it wrong. I mean, and look, I'm not trying to be a critic, because when you and I were first trained, that is exactly how we were trained. We were told, find that out, get as much information you can, report that to DCFS. Remember?
Yeah, I made that call.
Right.
To DCFS a couple of times. It kind of sucks in hindsight.
Right. Complete violation of Fifth Amendment rights. But again, what would we know differently? And at the time, it made perfect sense. Like, oh, yeah, these victims, the reason why we're doing this is no more victims. And kind of. I mean, and so them getting the treatment is really necessary. And again, that's positive sentiment. That's a compassionate approach. But that's not what I would say. Is if that's your approach, don't work with sex offenders.
Right.
You just shouldn't be working with them. That's not what the objective is.
And I know I mentioned that guy had heard of the high recidivism rate, but just to clarify, from the research you had, what was the recidivism rate for sexual offenders with a new sexual offense?
So nationwide, it's around 12%, and that includes internet-facilitated crimes, which are uniquely high because it's just, again, non-hands-on. It's just easy to do that. So 12%, which again, then you could say 88% effective in doing what we're hoping to accomplish. Now, in Utah, the most recent study, it was less than 1% of the almost 1,000 offenders that were released into the community committed a new sexual offense. And a small percentage, about 10%, committed a new crime, a new general crime, non-sexual related. But then it was about 48% committed violations of their parole or probation. Now, I suppose you could make the argument that had those violations not been carried through, that you may have a higher rate of sexual recidivism and non-sexual recidivism in terms of the actual crimes, because if they noticed that they were violating and then arrested them, they may cut it off. But who knows? We're just speculating there. But that's the actual statistics, which are incredibly low. I mean, if you look at recidivism rates with regards to like relapse rates with regards to like drug offenders, it's almost polar opposite. Just flip that around, and then you got the numbers for people coming back in as a result of those things. So
treatment is beneficial. Doing these things, especially Utah, right? You mentioned the low sexual reoffense. It's obviously something's going right.
Yeah, I think it's a mixture. I think it's a mixture of the amount of time of incarceration. A lot of people will make a case that sex offenders are overly convicted. In the court of public sentiments, I doubt you could ever argue against that and say, nope, they need to be punished less. I don't know. There's plenty of people who would support that. But I would say, is that just strict warehousing, or are they receiving rehabilitative treatment in the meantime with follow-up continued care in the community? When you see those things, you have an incredibly low recidivism rate, for sure. I would say it's very effective. So I'm curious, though, like about this idea that when they say, so polygraphs are not admissible in court, so I shouldn't have to do this, and you're it's inaccurate, it's totally inaccurate, all this other stuff, because when I was thinking about that, I think about other stuff that is admissible, like eyewitness testimony, right?
Which is, if you look at the least accurate things, see some TV shows.
Generally garbage.
Well, yeah. So this is one of the things that I had you watched that. Well, I don't know if you guys watched Making a Murderer.
Oh yeah.
Yeah. So they had went over. I was just reading some stuff about that, and it was saying that.
Is this a spoiler alert?
No. It was saying there's nothing.
He dies in the end.
Oh, thanks, guys.
Does he?
I haven't seen it yet.
Yeah.
So
it's good to watch though.
But ever since DNA rolled around, basically it was kind of saying that revolutionized forensic science, obviously. Because of the level of accuracy that's involved in DNA, right? And so that the Innocence Project, what they were saying was they had put a thing out there because that's who was represented. I think his name was Brendan Dassey. He was the kid that was involved in that. And they were saying 358 people who have been convicted and sentenced since 1989 have been exonerated through DNA evidence. Of these, 71% were convicted through. Of those 358. 71% of them had been convicted through eyewitness misidentification and had served an average of 14 years in prison before exoneration. Of those false identifications, 41% involved cross-racial misidentifications. In other words, 221 of the 358 people were African American. So sounds a little racist. And then 28% of those cases involved false confessions. So both of those things, interrogations and eyewitness testimony, 100%, admissible in court. Yeah. And I mean, horrible accuracy based on those numbers. But if I do a specific issue polygraph, that's all those things that I just said, based on behavior, delimited to time delimited, and then and it's just a simple yes or no. I mean, accuracy-wise, what percentile are we talking about?
So you're going single issue now, so you have a higher accuracy if you're going single issue. So if you look at the American Polygraph Association's meta-analysis that they did going over just tons of studies on different things, so you have the accuracy about 90% for a single issue test. And it's going to depend on a couple things too. So I was looking at some things because you hear things crazy on both sides, right? Like I was saying, like you hear the recidivism rate for sex offenders is the 90 percentile, right? And if you look on if you go to school on YouTube, you hear crazy things. I saw a polygraph examiner say it's 99% accurate, which is crazy, right, for polygraphs. But around like a Utah format, so a specific format with a certain scoring, like a ESS scoring, so specific formats with specific scoring, you got around 90% for a single issue test is where the studies show it to be. Other test formats, so some screening test formats that we do with a lot of post-conviction sex offender testing, depending on the format, you might get the average being around 86, 87%. So I'll never say it's perfect, right? But are they 70% wrong?
That's way better than what I'm seeing here. Like if you ask Stephen Avery, okay, so Teresa Hallbach was the chick that he supposedly murdered. If you had asked him a specific issue question, right, and so this was supposed to be, whatever day, what would it sound like? And then, if you're asking him, did you kill Teresa Hallbach? Would it just be that, or would it be on a certain date, or?
Well, it depends on what the situation was. Was she shot, stabbed? Specific.
That's all.
Did you shoot this person? Did you stab this person? Well, I didn't kill her. The bullet killed her. Okay. So being specific.
But yeah, they did say that he shot her. Yes.
Right. So like we said before, being specific on the behavior, being very clear about what you're talking about,
in his
defining
garage.
Things.
Shot her in his garage.
Okay.
Yeah. I'm remembering now.
Then they burned her.
Someone that does more of those testing, they're going to have specific questions. They're going to be more accurate, right?
Yeah.
So the the number is 90% though.
Around 90%. Again, it's going to depend on your test format. I believe the Utah test format, because there's some guys out here at the University of Utah that do some studies and things. And
so is there anywhere where that's legal? Because that sounds like why would you not have that in court if it's 90% accurate?
Right, and it's not 100, and obviously you don't want to convict someone.
Well, what is though?
Better than 15.
But so New Mexico, from my understanding, is it's legal to use in courts for anything, just like anything else. Other places,
always.
I believe so. I'd have to go back and look at, but that's what I've been told and looked at in the past. So New Mexico, it's more used as anything else can be, right? If you have your eyewitness, if you have your, do they use handwriting analysis?
We can be called into court, and I can tell you right now, my clinical judgment is definitely not 100%. No one's is.
And for lying.
Yeah.
So they've done studies. So the studies that I read on, and I may have mentioned this last time, right? The studies I read on the accuracy of your average person, and some of the studies may have had police officers on how accurate they were at telling if someone was telling a lie, was around 50%. I think one study I saw might have said 55%. So that's more the flip of a coin. So if I'm a therapist or a PO and I know that I'm about 50% accurate and I can have a test that's, 85 to 90% accurate to help me make difficult decisions, what do I want to do for that?
Mm-hmm.
So this kind of goes back to what I was asking you before we started the podcast. How much variability is there? So, it probably falls in the category of myth, but there's you hear clients kind of talking, a rumor mill gets circulating, and they'll talk about how some examiners are more likely to yield a passing score than others, and which is kind of puzzling. And that's something that I was telling you. My wife was kind of wanted me to ask you specifically. So, how much is it the machine? And how much is it the examiner in terms of your final conclusion?
So it's moving more and more towards computer scoring, right? So I just read a recent magazine. So every couple months, the American Polygraph Association puts out a magazine on maybe some more current information or things they're looking at. And
sounds like a real page turner.
It's exciting. But, something I was pointing out is how things are trying to turn more towards our computer scoring. So there's the objective scoring system. I believe 3 is the current objective scoring system, where they actually use the computer to do more of the scoring. And that's going to be more objective, I guess, than a person in general. It's going to be able to measure things more accurately than I can just with my eye. That looks a little bit smaller, but, it's going to have more accuracy. So right now, I still run things through the scoring system, the computer scoring system. There's some things that it just scores, period. Of course, it's not perfect yet, right? So I still have to do my scoring, and the end result is my opinion, right? So the computer helps, but it's still my opinion, but it's moving more towards that. But if you're using the same test formats will make a little difference, right? Some might be a little more accurate. and then the scoring system you use. So there's a couple different scoring systems. Most people have gone to this ESS empirical scoring system, which is a little simpler for examiners to use. Federal has a different scoring system that's much more complicated. So using the empirical scoring system, that really raises that inter-rater reliability. So, and sometimes on my waiver I can send this to another examiner for a quality review, right? So if I ever want a second opinion, and I think it's a great thing for examiners to do, send the chart, so they just have the chart data, right? So they score out chart data without knowing who this person was. And, the majority of the time, they're going to have the exact, well, not the exact same score, but the same opinion. So if someone fails, they might score overall, let's say they scored a -9 by me. Someone else might score a -8 or something. Both of them are fails, right? So inter-rater reliability with those types of scoring things are much, much higher. And having things turn more and more towards the computer, I'm excited about, because, the more I can put on the computer that's more accurate, that can do things even better than me, that has better measurements, the better, I say. And it's more scientific if you can run the same test format. It's not just, well, Johnny scored it like this, but I feel like this looks better.
I feel like, yeah.
Right. And some of the new schools, so Peak is a polygraph school in Florida, and that's where they've gone more with everything they're doing. So even if we go to our conferences, and if they're talking, they're like, if you ask me a question, I'm not going to tell you my personal opinion from my experience or things that I've been doing. I'm going to tell you this is what the research shows right now, which I think is the right way to go for these things. Right. And where it's changed over all the years. There was something on YouTube I saw with a guy from the 70s saying how nothing's changed since the 20s. And, it changes all the time, whether it's through studies and saying you can use these specific test formats that are this accurate versus back before the Employee Polygraph Protection Act passed, you didn't have those guidelines that you had to go by. So guidelines have changed, formats.
Why
using
do they?
The computer.
People say that a lot. They say the 20s. So in the 20s, because that's the Fry case.
Right.
It's a pretty famous case, which is the reason why polygraphs are not admissible. And if I'm not, I mean, you can kind of correct me on this, but this guy Fry, basically, this was in 1920. He shot and killed a doctor, right? And then he was murdered in his office, and then another physician was in the office and witnessed the shooting. And Fry ran out of the office with the eyewitness running after him, and then he turned around and took a couple shots at homeboy. And then, but since the witness didn't know who this Fry guy was, he fled and got away with it. And then almost a year later, it was like 7 or 8 months later, he got arrested for something else, like robbery. And then he confessed to the robbery and then also to the murder of that doctor. But then there was 2 tests performed. There was a polygraph, and then there was what was called a systolic blood pressure.
Intermittent systolic blood pressure test. I think, was there another test done as well?
Or was it only the systolic?
That was the one I was aware of at the time. So I believe
they didn't even compare it.
So I believe Marston was the polygraph examiner.
William Marston.
From the little bit that I know about it, and what he did was like I say, from what I was told and had read about, was an intermittent systolic blood pressure time of the test. So he asked a question, then he pumped up a blood pressure cuff and read their systolic blood pressure, right? And then he pumped it down.
Like the shit you get at Smith's?
Right.
The grocery store, where it just feels like it's going way too hard.
He went to the jail.
Starts to scare you. Yeah.
Yeah, just let's go to Smith's and let's pump it up
just lose
after
my
each question. So he'd ask,
equate polygraph.
But that's
he asked a question, pump it up, check, pump it down. Ask another question, pump it up, check, pump it down. So
they could wear some Air
raise.
Jordans too, so just pump it up.
So if that's what was done, and I haven't gone into all the exact details of everything, but from my understanding, if that's what was done, really, that's not even a polygraph, right? Polygraph is multiple graphs. You're looking at multiple readings versus just one reading that's changing. So, and again, there could be some differences. I don't have all the details, but Marston, that was my understanding.
William Marston wrote the book called The Lie Detector Test, and that was his version of the lie detector test, was systolic blood pressure, which is just, I'm taking your blood pressure, bro.
Right.
Like, that's it. So, well, no wonder the courts, rightly so, threw that nonsense out and said it was inadmissible. But how did that get caught up as a polygraph? Because clearly that's not a polygraph.
Yeah, I don't know.
Are they just saying it's?
I think,
but that's essentially where they're inadmissible, correct?
That's my understanding where it started. Him trying to get into a federal court, and then getting thrown out, and then from going through school. And again, I haven't gone back and done all the research on it, but yeah, they throw back. Go back to the Fry case, and we're not going to throw it out. So that was an initial thing, but
to me, is it like, okay? So you would think over time, a lawyer would come about and say, well, let's right this wrong, because clearly that's bullshit. Like, that shouldn't be the precedence for a polygraph evidence. But I don't know, if I think like a lawyer too. The other piece about that is, so if I'm the defense attorney and my client passes the polygraph, clearly I want that to come into evidence, but the prosecutor won't. On the other side, if I'm the prosecuting attorney and the defendant fails that, then I want that to come into evidence, and the defense attorney won't. So it sounds like it's never going to become admissible in court, right, because why would anybody ever do that?
Except for more rare cases when they do agree ahead of time. I mean,
if you're in New Mexico.
I mean, I can think of one exam.
Hashtag New Mexico, son.
I can think of one exam I did for a lawyer, and the judge had agreed that, so this was with a minor, and they agreed that, hey, if this kid did not actually commit this crime, then going through sex treatment might be have a more negative impact on him than if he didn't go through, right. So they had agreed with the lawyer that, hey, if he passes this polygraph test over the crime of conviction, so an instant offense test, then he won't have to go through treatment. So that was something where, in a way, that's being used in court, right? They had agreed on this for this kid for his particular situation with the lawyer.
But the prosecutor and the defense attorney agreed to that.
So I just with the lawyer. So I worked with the lawyer specifically, and that was the agreement that she said that they came up with. So I imagine in both cases that was agreed upon, but that was what she had said was agreed upon ahead of time for this. So you're working for a lawyer, and some of those lawyers, attorney-client privileges, I imagine some. If it's agreed upon by them, I'm not sure where some of those things change. I do less work for lawyers than someone like Tana Stone or some of these other ones. But it's not universally
inadmissible then.
Correct. That's my understanding.
Okay. Well, yeah, that just is. I mean, I think that would. That's just. I mean, I don't know. I think it's useful to validate a client's anxiety and concerns about the polygraph, and I wouldn't get into a damn argument with them. I think that's foolish. I don't think that's the right way to go. But I think for anybody listening to this, and like, I'm sure there's going to be comments from somebody about pseudoscience.
Right. Hasn't changed since the 20s.
That's the Twilight Zone.
And I think it was hokey back in the day. You hear things about, back in before the Employee Polygraph Protection Act passed, when you could do it for any job, right? 7-Eleven, take a polygraph. Someone stole something. Everyone at work take a polygraph.
Work somewhere else then.
And
that's not.
And they told us stories about a van pulling up in front of a job and running 20 or 30 or more polygraphs in a day.
What?
And of course,
do you like our nachos?
Of course, those were garbage back then. So to compare that to where they're at now with all the regulation,
like a food truck, but for polygraphs.
It's polygraph truck. Hey,
do you want to get for
your
lunch
girlfriend
today?
Cheating?
I don't know.
Are your kids lying?
Dude, what happened to that Fry guy? He didn't go to the electric chair or something, did he? That'd have been ironic.
Did he fry?
That'd have been bad. That'd have been good.
It's a zinger.
I got him good.
Yeah.
Don Fry.
So things have changed since then. And it's going the right direction. Higher education required. So they're requiring at least a bachelor's degree for the American Polygraph Association versus just the polygraph school. So it's a combination. So they're changing things.
Yeah, back in the day, you had to have looked at a junior high. Like, you had evidence that you looked at the building.
Do you think junior highs are real?
You've had to have told a lie to do it.
Have you ever lied?
Yeah.
No. And it shocks them. I love that. It electrocutes them.
That's awesome.
But I think Alpha, because I do most of my work with you guys, I think you guys do it the right way. Guys come in and they're so scared, like, what if I fail? And I'm like, well, if you're doing things the right way, I mean, even if someone has failed, I mean, they work with their therapist, clarify things, what else has happened. I mean, there's a lot of cases that I have where, a guy drank some beer and he hadn't told his therapist because he was embarrassed, or a guy that had been around some minors for the holidays because he was around family. So he had unauthorized contact he hadn't told his therapist about, but he was already there. Some family members showed up. They wanted to be around him. So, things come up. Usually it's not as significant. They come back and pass another one. So they're not immediately thrown in jail, and that should never really be a threat. Appeals shouldn't come to someone and say, you fail this, you're immediately going to prison. That's not the purpose, right?
It is crazy. I think it's like, if I was on that end of the treatment, like if I was the client, I'd have that feeling too. It's crazy how many guys, after they've failed a polygraph, will come in and tell me that's the first thing. Like, well, I've just heard if you fail, you're going to go back. I'm also like, purposely lied. But yeah, so I was like, I get that. Yeah. So I think sometimes they do have to kind of go through that and realize, like, see somebody else in group, or they themselves realize, okay, nothing happened. They just told me to work on it.
Obviously,
kind of brings
work on
their defense down a little.
Right. Obviously, you guys work on those things and clarify, but you guys use it the right way. Like, this is to help make sure we know what's going on. We've cleared things up. If there's anything significant, we're aware of it, as opposed to just immediately threatening. And I mean, and I don't think that helps. If a PO threatens someone, if I'm immediately going to go in and someone's like, you're dying if you fail this, then
You're dying.
Shoot you.
She's just sitting outside.
He just has the blinds pulled down. He's just looking in. He's
Oh,
so I
that'd
mean,
be awesome.
they're already stressful going in. Why add more stress? I mean, there's not going to.
Yeah.
I mean, is it going to make someone?
It's better
fail when
after-
they should pass. I don't think so.
better
but
when
it
they
doesn't
come back
help.
from a group and they're like, I failed, bro. And I'm like, why'd you lie, you lying liar? Then we go on from there. No.
Yeah, I think that's one of the best people they can hear that from is their PO. Like, hey, if you fail, we'll work with you. Like,
Well,
we're going to move
I mean,
forward.
and you got to put pressure on them sometimes. I've had guys.
Yeah.
One guy, he'd failed several. I think he'd failed some with Tana, failed maybe 2 with me, and then he came in the last time. He's like, they told me if I fail, this is getting too serious. Treatment says I'm not complying, and then he told me everything.
Some pressure.
And there was a
good
lot.
thing. Yeah.
There was a lot with animals and with people and with children. But the pressure, I think, in his particular case helped because he actually opened up and disclosed.
Well,
a lot
yeah,
of
if you
stuff
get to
I
that
think
point,
is beneficial.
well, I think it's okay to let them know
That's
they're kind of
nothing
forcing
normal.
it to that point sometimes, but right out of the gate. No,
Well,
Right.
I guess the message there, wrapping up here, is, I mean, even I just saw one that you did, and the client, like, so there was just, I mean, I won't get specific, but the client had failed the initial one and hadn't disclosed much of anything, right? And followed up, it was a bunch of like in group, it was like this is horseshit. That's that thing's bullshit. Is lying, and stirred up everybody. And all the clients were like, "Yeah, this is horrible. This is an injustice." And then he goes. Then he goes back and discloses like 30 things and passes. I'm like, whoa, that's amazing.
but I bet he didn't say that in group.
Well,
Yeah, no kidding.
Yeah.
Should have
he
made
was
him.
violated, and it was a problem for him because the things that he disclosed were violations, and then he had not talked to his therapist about those, which actually would have saved him and helped him in the process. And so I think that sends a shitty message to clients. If you're a client listening to this, I would so take everything those other guys say with a grain of salt, because I mean I've seen that so many times where they're like, man, that thing is bullshit. And then they're like, they disclose something to their therapist, and then they go back and pass. I'm like, wow, that's weird. That's so weird that you
And the group never hears the follow up.
right. They never say.
Yeah, they hear the
"Man,
guys that are frustrated from failing. Yeah,
Right. So, but then as also therapists listening to this, and hopefully it's interesting for people who didn't know much about it, but therapists listening to this know the function of that tool, and it's not designed for catching a client in a lie, or if you think they're being dishonest. And I think that's pointless. Why are you doing that? That's not the point of why we're trying to do a polygraph, and use it appropriately, because I don't think it does anybody any good, namely the polygraphers, to use the tool that way. I mean, I don't know. I'm sure you guys have ethics saying I probably shouldn't do this type of polygraph.
Well, then also adding to that too, like in my experience coming up on 5 years now, we've never had a case where someone passed and then we scrutinize that. We're like, oh, I don't know that he really passed, though. I don't think this is true. We just, okay, he passed. Awesome. Good job. We don't scrutinize it.
I've told a client, I've told him, I don't want to send you in, dude. I don't want to send you into this polygraph. And he's like, no, I'm ready. I'm like,
Calm down.
I don't think you are. So let's sit on it for a month. And he was pissed. And then I was like, I still don't think this is going to go well. And then he went in and passed. And
Yeah,
I was like,
it happens.
Good for you, brother. Like,
Yeah.
I was like, I was wrong. I'll be the first to admit
I
that
get
was
ones like
wrong.
that.
I'm sorry. I misjudged it, and I was just trying to be as honest as I could with you. So that's about as good as you're going to get.
Ed, anything you want to say? Winding us up? Any contact information? I don't know if we managed that in the outset of this podcast.
What's your pager number? Please. Is it hello? Upside down?
Hello, upside down. Hello, kitty.
Hello? 911.
What was I love you upside down? What'd you have to do? It's like
Are you talking about like a sexual
Mace
position?
had a pager.
A pager.
Dude, I had one. I for sure had one.
Hell yeah,
That's like the
so-
most worthless thing ever. Someone wants to contact me, but I can't call them back right now.
Well, yeah, that's,
payphone.
So at some
But
point,
there were
yeah.
payphones.
yeah, that's back when payphones existed. Yeah,
I'm already paying for my pager, dude. I can't afford a payphone.
you get a pay. Yeah,
It's
you
like
get a pay
75
card.
cents.
Yeah. So how do people get in contact with you?
So I talk to your therapist. If you
That's
need to
a
get hold of
payphone.
primepolygraph@gmail.com. There's also polygrapher information on if you Google the Utah Polygraph Association, that shows polygraph examiners in Utah. It shows who's post-conviction sex offender testing qualified as well on there.
Who heads that up right now?
So the president, I believe, currently of the Utah Polygraph Association is John Pickup
When are you going to be the president?
out in
though?
Utah County, and I'm not.
Edward Cook for president. I'll campaign for you, you loser.
So I'm part
Utah's
of the.
best lie detector.
So I'm part of the board.
2020, son.
I'm part of the board of the Department of Occupational Professional Licensing. So as a member of that board, I can't become president of the United States or as part of the Utah
What do you do on
Polygraph
that
Now what are we
Association.
gonna
You guys just break boards.
So, yeah.
You just sit
With our
around bored all day.
foreheads.
You're just bored. We don't have anything to do, man.
But I'd say just make sure that you're talking to your therapist. Guys come in freaking out about things, and initially, I guess it's good for guys to know that when you come in, it's not immediately jumping onto a polygraph, being electrocuted or something. There's like an hour interview before we get into anything where we answer questions, we clarify things. We're not out to get you, which I think some guys I worry about. And if you have questions, I think it's a great idea to ask them when you're in there. I mean, don't be scared to clarify, ask questions. That's what I'm there for, and sometimes guys wait until they've failed one and they come back like, oh, what about this? Or I didn't say this. Ask those questions so you don't have to come back that second time with an examiner.
I was going to say, to your credit,
also-
usually when I have a guy go to you, they usually come back and say really good things. Like,
Yeah.
It wasn't at all like I thought. He was really cool. He
Yeah.
made it really comfortable.
Yeah.
Yeah, I usually hear good things.
So we'll have to have you back a third time, but the third time we'll do a
I was going to say,
live broadcast of a polygraph.
Of mace.
You can test me on anything.
you're going to be handcuffed while you do it.
but we'll do a live broadcast at post marriage, right? Of yeah.
Post-mortem.
post mortem, post
That's
marriage.
what it will be.
Yeah, like a live. Yeah, that'd be any question that listeners. That'd be good to get some comments. What are some questions that listeners want to ask us as me and Jeff and Justin? What
It's
would
just,
the listeners
it's just
wanna know?
immediately, I don't want to incriminate myself.
I'm going to go ahead and invoke my Fifth Amendment, right?
1, 2, 3, 4, 5.
Okay,
Thanks for coming.
cool. Thanks everybody.
Thanks, guys.
All right, that's a wrap for this episode. We want to thank you for tuning in. We also would like to thank Mr. Cook for coming on the show again. We'll have him back soon to do the live lie detector where Mace gets electrocuted. I don't know what's going to happen there. But yeah, check us out on Facebook, Guerrilla Social Work Podcast, or at whatever website you want to check us out on. I always want to say MySpace. I don't know why. That's really stupid. But yeah, we're going to be back. Our next episode is going to be 31, where we're going to talk about stress reduction. So that'll probably happen within the next 4 or 5 weeks, months. We'll be just keep an eye out. All right. See you then.